This is National Medication Safety Week, and Saturday is the annual Drug Take-Back Day. We'll have more on that in just a few minutes. Joining me now, ABC 7 medical contributor Dr. Ogechika Alozie with Sunset West Health. This really is an important week.
It is, and it's one of those things that we don't think about enough. But if you go through every home's medication cabinet, you'll find on average 4 to 7 bottles of medication. And so it's important once in a while to just remind people that medication errors are actually the 6th leading cause of death in the United States.
Well, there's something called medication harm. Can you explain that?
So it comes up with a lot of different things. And so 50% of those are avoidable, and whether it's at home or in the hospital. Obviously, you watching today can't necessarily change what's happening in the hospital, but always remember when somebody receives a medication, especially if they're elderly, about to have surgery, in an ICU, have been given medication to go home, those medications can cause overdoses, they can cause other interactions with other medications, and essentially it costs a lot of money, but forget about the money. It's the harm that it can cause to you and your loved ones that's so important for us to try to avoid.
And medication safety is crucial, whether you're the one taking the medicine or if you're giving it to a loved one. Talk about these 5 moments for medication safety.
And we all go through this, right? So you go to see your doctor or clinician and they give you a prescription. That's the start. You want to make sure that they're giving you the right medication for the right ailment that you have. Are you taking your medication? Many medications have to either be taken with food in your stomach or without food in your stomach. In the morning, in the evening, once a day, twice a day, 3 times a day. You get the picture. Whenever you add a medication, have a clear conversation with your clinician about, do I need this medication? Hey, by the way, I'm on 3 other medications, including potentially Coumadin, or some other medications that can make you sicker if you take others. Always review your medication. I know this is hard, especially if you're not used to it, but I tell people always have a list in the pocket, in your phone, in whatever it is. Give the list to somebody else. Give the list to a friend or a loved one. And stopping medication. Should you be stopping it at the right time? I'm an antibiotic guy, and I always tell people at the end of the medication, stop them.
And I have a list of medications in my pocket, including my allergies to certain medications, which is good to have, folks.
Perfect.
All right, now let's talk about storing medicine, especially if you have small kids at home.
I think this is the key with kids especially, which is if you have medications, and that's why we have those lock bottles, right? Those came into effect about 30 years ago, specifically because of kids. It doesn't take any time. They move like that. Anybody that has a toddler around the house knows whether it's from sockets to medications to glass, you got to child-proof your home, right? Every 9 minutes, a child under the age of 6 goes to the ER because of an overdose or medication you shouldn't take in. And every hour, one of those children is hospitalized. So every 12 days, somebody dies. These are all preventable, right? And it's not just enough to have that container that has a locked top. Just put them away. If you can reach your hand to get it, it's too close.
Finally, when the medicine has expired, you need to know how to dispose of it properly.
You know, it's interesting. I didn't know about this, right, until I started thinking about this topic. I was one of those people that would either just throw them in the trash or pour it down the toilet, right? But there's a list, and the FDA has what's called a flush list, and you can go to the FDA or the DA's website and find what those are. So if you can flush it, put it down the toilet. But if you can't, and there are some toxic medications, I think you've actually done a story before about water concentration of drugs that are in our system, and we can reduce that by not pouring those things down the drain and down the toilet.
Now let's talk about Prescription Take-Back Day this Saturday. It is happening April 22nd, Saturday, 10 a.m. to 2 p.m. You can go to the police department, you can go to the sheriff's department. There are other locations around town where you can drop off meds.
Absolutely. And I know people will say, well, why do I got to do this? I don't need to do this. But again, extra medications can be dangerous. You don't need them. And besides that, they clutter up your cabinet. Just get rid of them. So this is an easy way to do that.
Yeah, check those expiration dates on those bottles, folks. That's why they're there. Dr. Ogechika Alozie, thanks so much.
Thank you, sir.